Continuing with our series of pediatric dental anatomy, in this video we will be talking about the detailed dental anatomy of primary maxillary canine. Watch the video till the end to understand it well. Hi, we at DentoRise welcome you all to a platform where we help you to conceptualize, visualize and memorize dentistry. According to the FDI tooth notation system, the right primary maxillary canine is numbered as 5-3 and the left primary maxillary canine is numbered as 6-3. Similar to other teeth, this video will also be discussed under 4 headings. The labial aspect, the lingual aspect, the mesial and the distal aspect will be discussed under one heading, that is the proximal aspects, and the incisal aspect. Starting with the labial aspect first of all, coming to the dimensions, the length of the crown cervico-incisally is 6.5 mm. Length of the root is 13.5 mm, that means double the length of the crown approximately. The mesodistal diameter of the crown is 7 mm. The mesodistal diameter of the crown at the cervix is 5.1 mm. This implies that the crown is more constricted at the cervix in relation to the mesodistal width. When we compare the labial aspect of a primary maxillary canine with that of a permanent maxillary canine, there are significant differences. The first difference lies in the mesial and the distal surface. These surfaces of a primary maxillary canine are more convex in comparison to a permanent maxillary canine, as you can observe in the figure. The second difference lies in the mesial and the distal slopes of the cusp. In a permanent maxillary canine, if you can recall, the mesial slope is shorter than the distal slope. However, in a primary maxillary canine, the mesial slope is longer than that of the distal slope. You can again observe the figure. When we compare the cusp of these two teeth, the cusp on a primary maxillary canine is much longer, sharper and well developed than that of the permanent maxillary canine. Also, in a primary maxillary canine, the crest of the contour mesially is not more towards the incisal portion as that of the permanent maxillary canine. Please observe the figure. Another difference lies in the level of contact areas. In a permanent maxillary canine, the mesial and the distal contact areas are not present at the same level. However, in a primary maxillary canine, they are present at the same level in such a way that a line drawn through these contact areas would bisect a line drawn from the cervix to the tip of the cusp. Please observe the figure. Now, coming to the lingual aspect of primary maxillary canine, this lingual aspect shows pronounced enamel ridges that merge with each other. Starting cervically, we can see a well-developed cingulum. We can see the mesial marginal ridge and the distal marginal ridge. Coming down incisally, we can also observe the incisal cusp ridges. At the cusp tip, we have a tubercle. From the cingulum till the cusp tip in the center, there is a lingual ridge. This lingual ridge divides the lingual aspect of the crown into two fossae that are named as the mesolingual fossa and the distolingual fossa. If we talk about the root of this tooth tapers lingually and it is usually inclined distally but above the middle third. Please observe the figure. Now, coming to the proximal aspects, there are just 2 points which we need to remember. The first point lies collectively for the mesial and the distal aspect, that is of the dimensions. The labiolingual diameter of the crown is 7 mm and the labiolingual diameter of the crown at the cervix is 5.5 mm. Now, if we compare this labiolingual diameter of the crown at cervix of a primary maxillary canine with that of the primary maxillary central and lateral incisor, then this dimension of canine is greater than the other two teeth, which permits this tooth to resist any kind of forces that the tooth may bear during function. The second point differentiates between the mesial and the distal aspect of this particular tooth, wherein the curvature of cervical line is more towards the mesial aspect than that of the distal aspect. Now, coming to the incisal aspect, overall the crown of primary maxillary canine from the incisal aspect is somewhat like a diamond shape. You can observe the figure. Also, if we compare the incisal aspect of a primary maxillary canine than that of the permanent maxillary canine, then the angles that are found at the mesial and the distal contact areas, the angle which is found at the cingulum and the cervical third, and also the angle which is found at the enamel ridge on the labial surface, these angles in a primary maxillary canine are more pronounced and less rounded in comparison with that of the permanent maxillary canine. Please observe the figure and differentiate. If we look at the tip of the cusp and slopes of the cusp, we have already discussed that the mesial slope is longer than the distal slope. Also, the tip of the cusp is distal to the center of the crown, as you can see in the figure. Both these features allow for intercuspation of primary maxillary canine with that of the primary mandibular canine, which has its longest slope distally. So that was all about the dental anatomy of primary maxillary canine. Hope the video was helpful for you. If you like our content, please do not forget to like, share and subscribe to our channel. Hit the bell icon so that you can get notified whenever we upload any new video. Suggestions are always welcome from your side. Stay tuned, stay safe. Thank you for watching.